Hey, Patch.com, I heard you've got some questions for me. So Parkinson's disease is a progressive neurologic disorder. It results from a lack of a chemical called dopamine in the brain. It manifests as slowness of movement, stiffness in the limbs. They can have shaking in their hands or legs, and sometimes they have gait and balance problems. It can significantly compromise people's quality of life. And the way we treat this is generally with medical therapy, trying to replace dopamine. And this can work for a period of time, but over a number of years becomes less effective. And then we go to a second option, which is deep brain stimulation. So DBS is very similar to pacemaker technology. It's like a pacemaker for the brain. It tends to reset the abnormal rhythms that are associated with things like Parkinson's disease. The technology has been out there for probably about 20 years, but more recently, a new technology has been developed by Boston Scientific called the Vercise DBS system. The advantages to this system are that it's based off a different platform called the cochlear stimulation platform. And this requires very precise amounts of current to be delivered at, frankly, very precise locations in the brain. And this new technology has been very helpful in that regard. In addition, it actually has a smaller battery. It's called a pulse generator that's placed in the chest. It's circular and it's rechargeable for up to 15 years. There are a couple of websites that they can go to, and I think they'll get the information that they would need at these websites. That's dbsandme.com. It's a resource from Boston Scientific, who I'm working with today, but also the University of Minnesota DBS website. It's a Parkinson's Disease Udall Center of Excellence website. And I think you'll get most of your answers at one of these two websites.